Hey folks, how you doing today? My name is Rob, and if you're watching this video right now, you're probably looking for information about Part C of Medicare. And I've actually been an insurance agent for almost 20 years now, specializing in working with retirees, specifically on long-term care insurance, annuities, and lo and behold, Medicare. So I've got some great information for you today. And again, if you're looking for Part C information, stay tuned because I'm going to go over some pretty good nuggets of information for you. And anyway, I'm going to get out of this video so that I can enlarge the screen so that you can see all the good information I have for you. So stay tuned. Thanks so much. Take care.
Hey folks, so we're back. How you doing today? This is Rob, and hopefully you can see this screen okay, because I wanted to enlarge it so that you could see some of the different topics I want to talk about. And I'm going to try to keep this under 5 minutes because you can always head over to my website to get more information. I just want to give you a broad overview of what Part C is all about, because that's what you're here to watch. And again, Part C is what's known as a Medicare Advantage plan, as we mentioned earlier, and they are offered through private insurance companies. And these companies are all authorized to offer these plans. They have to meet certain guidelines and stipulations through CMS, which stands for Centers for Medicare and Medicaid Services. And essentially, what they do in a nutshell is they combine parts A, B, and sometimes D into one convenient plan known as Part C. And I know that can be relatively confusing because there is Plan C through Medicare supplement plans, which is known as Plan C. Some people confuse Plan C with Part C, two totally different things. Up until a few years ago, your only choices were to either take Medicare on its own or take what's called a Medicare supplement plan or a Medigap plan. And I don't want to confuse any of you, but they're two totally separate things. Medicare supplement plans usually have premiums every month. They always do have premiums, and you can get a plan either A through N. One of them is Plan C, but that's not what we're talking about today. We're talking about Part C of Medicare, or again, what's known as Medicare Advantage plans. You can only have one or the other. You can't have both. So some people choose, rather than paying a monthly premium for a supplement plan to plug the gaps of Medicare, they choose to get a Part C plan, of Medicare. And excuse me, I'm moving this around here. But anyway, they choose to get the Part C, and what it does, basically, it covers everything that original Medicare offers and sometimes more. And basically, it covers hospitals, your hospital, doctors, x-rays, MRIs, blood work, prescription drugs, eye exams, sometimes gym memberships, sometimes extra dental benefits at low or no premiums. And again, these are just some examples of what they cover. And again, I don't want to get too involved. You can always head over to my website to get more information, but I just wanted to give you kind of a broad overview. Basically, instead of having deductibles like you do with Medicare, many of these plans are copay oriented. So, for example, if you went to see your doctor, you may pay a $5 or $10 copay for a doctor visit. Let's say you're not feeling well, you have the flu, or for whatever reason, you're just not, you need to go see the doctor. Some have $5 copays, some have 10, some have 15. And then for specialists, it might be a little bit higher. It might be 20, 25, maybe even $40 to go see that doctor. Same with like x-rays. Simple x-rays may be $10. They may be 15, they may be 20, depending on what company and what plan you go with. Same with MRIs. MRIs, sometimes they have a capped copay at $100. Sometimes it might be $50. Sometimes it might be 20% of whatever the overall bill is. It really depends on the company. Same with blood work. Blood work may be a $10 copay. Sometimes it's a zero copay, so it all depends. Same with prescription drugs. Typically, they're tiered out, tiers 1 through 5. Tier 1 would be like your generic. Tiers 1 and 2 really. Then tiers 2, 3 sometimes get into the brand and non-preferred brand, and then tiers 4 and 5 get into the more expensive prescriptions. But typically, you have anywhere from a $3 copay for a 30-day supply up to maybe $45 for a 30-day supply. Some of them, a lot of these plans also do mail order, which is a lot cheaper to do it that way. Again, sometimes with these plans, not only do you get an eye exam, but you get extra benefits towards glasses. Sometimes they'll give you, an extra $100 or $150 towards your lenses and frames. So that's some of the extras we talked about. Same with gym memberships. There's something called Silver Sneakers where you can get a local gym membership much cheaper than if you went and tried to purchase it on your own. Same with dental. Some of the dental benefits, they provide up to $1,500 annual for different services. And again, you'd have to check with your agent on what the additional premium might be for that. And then again, as far as the plan itself, some of the premiums are anywhere from $29 a month to $99 a month, all the way down. Believe it or not, some of these plans have zero premiums. In other words, other than paying your Part B premium, which comes out every month out of your Social Security, these plans have no additional premium if you sign up for them. So I know that can be a little confusing. Some people say, well, how can there be no premium? You have to remember, folks, that through your Social Security, you paid in to Social Security and Medicare for many, many years. That's why some people, actually anybody really, is eligible to take advantage of these Medicare Advantage plans, hence the name. So again, the one drawback though, unlike Medicare supplement plans where you can go see any doctor, any hospital, these are network based. So I just want to stress to you that whoever you consult, your agent or whoever it is, you want to make sure that your doctor, your hospital, and all of your prescription drugs are in the formularies within these Part C plans. So hopefully that all makes sense. And again, most of the Medicare Advantage plans, depending on what state you live in and how rural you are or how metro you are, you may have all the doctors, or maybe some of the doctors may be out of network. So you want to consult your agent on that. But anyway, this is just a broad overview. Head over to my website and check out more information. And I have some closing thoughts for you. So stay tuned. Thanks so much.
Okay, folks, we're back, and hopefully you got some good information about how Medicare works. And again, if you're still confused, head over to my website, medicarechanges.news. I've got some great information. I've also got some great informational videos that I've set up about Parts A, Part B, Part C, Part D, how it all works. Plus, you can get quotes from me, prices from different carriers. So have a great day, and I appreciate it. Thanks so much. Or you can always give me a call at my 800 number. Thanks again, and take care. Bye.